This next adjustment is a supine bimanual grasp distal femur for an internal or external rotation restriction of the hip joint. This adjustment uses a drop, and my table does not have a drop, so we'll get to pretend together. So I'm going to take my patient's knee, I'm going to bend her knee up here. If you remember when we did our palpation, we did an external and an internal rotation assessment with the knee flexed like this or the hip flexed like this. And so we're going to adjust it in that same manner. We would use a drop in our either lower thoracic or lumbar piece and then set that drop for our patient's body weight. What we're going to do is we're going to use kind of an A to P force and then an internal and external rotation to assist in giving that hip a little bit more internal or external rotation. So what that looks like is if I grab my patient's leg here, I've kind of got this under-over bimanual grasp on that distal femur here. I can induce an internal rotation or an external rotation. Now she's got a ton of external rotation, so we don't actually need to do that adjustment for her. But the internal rotation would be something that we would look at. And so we would bring that patient over into that internal rotation presentation with our drop set and then just simply drop our body weight down the shaft of the femur so that we can induce a kind of an internal rotation as we're doing that A to P compressive force. So this was a supine bimanual grasp distal femur for an internal or external rotation restriction of the hip joint.